Honorable Ekweduro, the Speaker of the Senate, representative of the Speaker of the National Assembly, honorable senators present, honorable members of Parliament present, Principal Secretary for Planning, Engineer Mangiti, U.S. Ambassador Robert Godek, WHO Director, Reproductive Health, Professor Tenemaman, all development partners present, distinguished guests, ladies and gentlemen. It is another great day in our nation when our legislators meet with the development partners to discuss a matter of great national importance: accelerating attainment of Millennium Development Goals number 4 and 5, and more specifically, ending preventable maternal and newborn deaths in our country. Kenya is among the countries in the world with high maternal deaths, a situation which we can reverse. Many women and newborns are dying unnecessarily. In this country, we lose over 6,000 mothers every year, a statistic that does not augur well with our new status as a middle-level economic nation. To quote Her Excellency the First Lady, this figure translates to a loss of 18 to 20 mothers by the end of the day today, which is equivalent to an 18-seater minibus with pregnant women crashing and killing all the passengers every day. Ladies and gentlemen, maternal death not only reflects a gap in the health system, but also the need to address socio-economic challenges and disparities. It is for this reason that I do highly acknowledge the strategies the government has put in place through the Ministry of Devolution and Planning. Empowerment strategies such as the free education policy, microfinancing through WEZO, Women's Fund and Youth Fund will all go a long way in improving the health status of the society. The Ministry of Health has highlighted maternal and newborn health in the draft health bill, which will be presented before you for debate. In reference to maternal mortality, the bill underscores the importance of understanding causes of every maternal and newborn death, because this defines the appropriate response to prevent and avert other future deaths. Alongside this, the Ministry of Health is developing a policy to govern the implementation of free maternity services. The Constitution of Kenya 2010 gives every citizen a right to health, including reproductive health. It also provides for increased access to health services through devolution. The onus is on us as leaders to bring this to reality to the many young women and mothers who seek quality services from our health facilities. Improving our health system to deliver quality services for mothers, newborns, and the children require increased and prudent use of resources, especially to address the human resources for health, medicines and supplies, infrastructure, as well as the community health system. As much as there have been recent improvement in the total budget allocation to health, a lot more still needs to be done to attain the Abuja target of 15%. It is for this reason that I urge the legislators to increase the resource allocation to reproductive, maternal, newborn, and child health services, and with a budget line to that effect. Ladies and gentlemen, reducing maternal deaths requires concerted multi-sectoral investments. Hence, the other social determinants of health that we must address include education, especially of girls, gender equality, the roads infrastructure, sanitation, and provision of clean water, amongst many others. It is important for us as leaders to rally our constituents to utilize skilled health services both at facility and community level. As we improve service availability in the health facilities, this must be matched by increased health-seeking behavior by both men and women, and particularly the youth. Having had deliberations with the county governors, we will be reaching out to the members of the county assemblies from the 15 counties to further advocate for prioritization of maternal and newborn health in their development agenda. Lastly, I want to thank all the development partners that have supported the Ministry of Health and the government in general to deliver services to its citizens. We are looking forward for your continued support. Thank you, and